Sharp needle stick injury prevention. This is really important. Obviously, this is one of the most common injuries for phlebotomists is accidentally sticking himself with a needle. Obviously, this can be very, very, very concerning, as this is how infections and diseases can be passed through. So it's really important we're being careful. So, accidental needle sticks are a major concern in healthcare. A recent study by the CDC, so the Center for Disease Control and Prevention, estimated that approximately 1,000 accidental needle sticks occur per day nationwide. Most of these injuries are to nurses, phlebotomists, are at risk too. We're using needles constantly. That's our entire job. To respond to this problem, what's happened is OSHA, all right, issued a directive. And what they did was they're stressing the use of safety devices that help reduce the number of sharps injuries. Remember in a prior PowerPoint, we talked about how needles, a lot of injections, needles, syringes, they all have, a lot of them have safety devices that retract the needle or have a cover that automatically go over the needle. That way these injuries cannot happen. So what they did is they called this the Needle Stick Safety and Prevention Act. And it specified types of engineering controls that mentioned in OSHA's bloodborne pathogen standard to increase needle safety. So it's something that's continuously being worked on, but it's still something we need to be very, very aware of. 1,000 a day is a lot, especially due to the dangers that come. The introduction of somebody else's bodily fluids into yours is a huge cause for concern. So why do these happen? So injuries can be caused by some of the following reasons. Failure to activate the safety device after using a needle. Attempting to recap a needle. That's something you should never, ever, ever, ever do. Transferring blood specimens from a syringe into a collection tube. Use of needles without safety devices. Or overfilling the biohazard sharps container. So not replacing it when it should and continue to try to stick stuff in there. And the use of non-retractable puncture devices for finger sticks. All right. These are all things that can lead. So finger sticks, dermal punctures. That's what we're talking about there. All these are reasons that have an increased cause of injuries. So these are things to be thinking about, aware of, and doing everything you can to prevent these injuries. Some phlebotomists may attempt to cut some safety corners, all right, make shortcuts. And this is where we see a lot of these needle and stick injuries happen, especially when you start gaining more confidence and you're feeling more comfortable using the needles and handling the sharps. There is never a good enough reason to take such a risk, all right? The risk of infection is always going to be present, all right? And it might take months to find out and learn results of whether you've been this infection has been passed on to you. And that's a lot of months of worrying and psychological trauma. All right. So make sure you don't cut corners when it comes to safety. All right. That's all I can say about this. There's no rhyme. There's no reason for you to cut any corners with this. Now, something happens. They call it an accident for a reason. You accidentally stick yourself with a needle or on somebody else. So if you are stuck by a used needle or other sharp object that has been in contact with blood, or if you get blood somehow in your eyes, your nose, your mouth, or broken skin, what you need to do is immediately flood the exposed area with water and clean any wound with soap and water or a skin disinfectant. And once again, I can't highlight enough, that needs to happen immediately. You immediately also, once you finish that, report this to your employer or your supervisor. They are required to keep a log of incidents such as this. This is where an incident report would come in play. Then you'll have to follow your facility's exposure control plan for reporting and medical treatment for an accidental needle exposure. Okay? So there's a set of standards they have in place on exactly what you need to do after this happens. You're going to need to seek immediate medical attention, including counseling for exposure to HIV, HBV, and HCV. So once again, a needle stick injury is a very, very serious thing. This is why our safety steps are in place and we have them to use them. And so things like this don't happen. So with analytic errors, what can we do to prevent these errors from happening? So quality control basically is what we're talking about. So a prime example to sort of just give you an idea where we're going with this is we're making sure we're checking the expiration date of our tubes before we go to collect blood. All right, we don't want to use tubes that are expired. That's going to lead to an error in the results. We want to make sure we're following these steps to avoid any of these analytic errors. We're making sure we're coordinating our patients properly. We're identifying them before we draw blood. We're verifying the time of the specimen collection. We're verifying the usage of the proper tubes. We're making sure the patient is prepared. So if they're having a blood test that requires them to fast, not eat, or possibly drink, have or not have a certain medication, that has actually happened. So asking that question before we draw the blood. We want to make sure so if they have the basal state, which is usually in the early morning, about 12 hours after the last ingestion of food, if the specimen is lipemic. So what do I mean by this is there's a high concentration of lipids or fats. So this means when this clear yellowish serum turns into a foggy purulent one. All right. This usually is an indicator that the patient is not fasting. All right. During collection, we want to be aware of the possibility of the following analytic errors: wrong order of draw. All right. This is a huge one. Remember, we have an order of a draw for a reason. All right. There's a reason why we're drawing the blood, these tubes in a specific order. Make sure there hasn't been an extended tourniquet time. We don't want to leave that tourniquet on for an extended period of time. Hemolysis and failure to invert the tubes. Remember, each tube needs to be inverted, all right, gently to make sure that the additives are getting mixed with the specimen that we just drew. Some of these errors are possible errors that can occur after we've collected the specimen. So one, improper storage of specimens, so not storing them correctly. Improper usage of serum separator tubes, so we didn't use the tubes correctly, the SST tubes. Turbid serum appears cloudy or milky and results from some type of bacterial contamination or high lipid levels in the blood. All right, so these are some errors that may occur after we collect. So just things to be aware of that could contaminate the collection afterwards.